Have 5:30, so I'm going to go ahead and call the meeting to order. It's the Board of Commissioners meeting on March 8th, 2021 at 5:30. Just a few housekeeping items. We are holding this meeting virtually in accordance with Public Act 254 of 2020. As such, during attendance, commissioners are required to provide their location, city, township, county, state, during the roll call. Also, all votes taken tonight will be done by roll call. And would also like to mention the meeting is being recorded. However, if you would like to record the meeting on your own computer, please indicate so by using the Zoom raise your hand function, and you'll be given permission to record the meeting on your own computer. I do want to mention that while the meeting is recorded, the official record of the meeting will be the minutes kept by the county clerk. We'll have call to the public's where it's an opportunity for the public to address the Board of Commissioners. Every citizen will have up to 3 minutes. We ask that they give their name and address before proceeding with their statement. I just want to remind people that it's opportunity for citizens to present information of importance to the board. It's not intended to be a two-way conversation. There is a call to the public at the beginning of the meeting, and then a call to the public at the end of the meeting. With that being said, if you would join me in a moment of silent reflection before we get going. Thank you. Now, if you would rise and join me in the Pledge of Allegiance. I pledge
allegiance to the flag of the United States of America
and to the republic for which it stands, one nation,
under God, indivisible, liberty and justice for all.
Get the flag back. Roll call, please.
Commissioner Nakagiri.
Here, Heartland Township, Livingston County, Michigan.
Commissioner Griffith.
Good evening, participating from Genoa Township, Livingston County, Michigan.
Commissioner Lawrence.
Here, participating from the city of Brighton, Livingston County, Michigan.
Commissioner Reeder.
Here, present, coming from Deerfield Township, County of Livingston, State of Michigan.
Thank you. Commissioner Helserman.
Present, finally, from Handy Township, Livingston County, Michigan.
Commissioner Drick.
Present, City of Howell, Livingston County, State of Michigan.
Commissioner Zajac.
Present from Marion Township, Livingston County, Michigan.
Commissioner Gross.
Present, attending from Green Oak Township, Livingston County, Michigan.
And Commissioner Plank.
Good evening, everyone. Green Oak Township, Livingston County, Michigan.
Quorum is present.
Thank you. Item 5 on the agenda is correspondence. We have correspondence from Berrien County, Crawford County, Iron County, and Otsego County. Is there a motion to receive the correspondence and place on file?
So moved, Lawrence.
Support, Gross.
We have a motion by Lawrence and support by Gross. Roll call, please.
Commissioner Lawrence.
Yes.
Commissioner Reeder.
Yes.
Commissioner Nakagiri.
Yes.
Commissioner Helserman.
Yes.
Commissioner Drick.
Yes.
Commissioner Zajac.
Yes.
Commissioner Griffith.
Yes.
Commissioner Gross.
Yes.
Commissioner Plank.
Yes.
Motion carries.
Thank you. Item number 6 on the agenda is our first call of the public. If there's anybody in the public wishing to address the Board of Commissioners tonight, please indicate so by
Oh, excuse me.
raise your
Oh,
hand.
bless you.
Thank you.
Or just wave at us if you can't find the raise your hand function. I see Ms. Suarez Ford waving at us. So you're unmuted. Go ahead.
Okay. I would like to talk again about the lack of COVID vaccines in Livingston County. Briefly, my husband, 74 and a half years old, 2 comorbidities. He signed up with the Livingston Health Department, Rite Aid. I go on there every day. There's nothing to be found within 10 miles. Those are the options they give you. Nothing from Walgreens, nothing from Myers. There's just nothing. He signed up with 2 hospitals where his primary care doctor is at. There's nothing. And now I noticed that the governor is adding more groups to the mix. And I think this is not a very good recipe it's a recipe for disaster. And I've been reading articles that people are starting to get angry at her plan for this vaccine rollout. I don't know what she's thinking, but it's not going very well. And I'm not happy about this. Now I'm eligible. I'm 64 and a half, and I'm not happy about this at all. I'm also, I read something from WXYZ Detroit that another high-profile official in Detroit turned down 6,200 doses of the Johnson & Johnson vaccine. And in a statement to CNN, Michigan State Department of Health, Bob Wheaton, said that those vaccine doses not used by Detroit were provided to other health departments that had lower coverage rates for those aged 65 years and older. So I'd like to know, what does lower coverage rates mean? And I don't know, maybe somebody could explain that. This whole high-profile individual said that it would make more sense to use a single-dose vaccine in rural areas. And maybe somebody could explain that. Maybe Charlie LaDuff should ask him, go down to his office and ask him. He seems to be an unbiased journalist. And lately, it seems like the Biden Whitmer administration been walking back this official's remarks. And now I guess we're not going to get any Johnson & Johnson vaccine for 2 weeks. And I was wondering, why is that? So we've been told we're going to get more and more vaccine, but now we're not going to get anything, to make matters worse. So I just don't know. It just seems like mismanagement of this vaccine rollout. And it's not a good thing for our seniors. And I'm on here to speak up for our senior citizens. And I see a lot of letters to the editor of this Livingston Post being put on that, I don't know, they're not speaking up for my husband and people like me. So I'm speaking up for those people, because they may be intimidated. They don't even know how to get on a computer to sign up for these vaccines. They're intimidated by Zoom. So this is why I'm on here for. If it's my time is up, let me know. But I'm on here to speak up for those kind of individuals. And I probably will come on the second call to speak about the nursing home scandal. I'll probably speak about that because I have someone in a nursing home too. I haven't even gotten to that. But I just want to speak about my husband. We're still sitting here with no vaccines, and nobody in my family is vaccinated. And that's to me is outrageous. When we're now into the 50 plus category now being added.
Your time is up,
Thank
but
you.
I would tell you that on the agenda, we have an update.
Right, I saw that. That's why I got on the call. Thank you.
Thank you very much. I don't see anybody else. So I'm going to go ahead and close the,
Hey, Wes, it looks like David Helen is got his hands up.
Hi, am I on?
Mr. Nakagiri, you're on mute.
Am I on?
yes, go ahead, Mr. Hallinan.
Okay. I was just thinking back to the last meeting I participated in, and there was a lot of talk about minority status and immigration and all that kind of stuff. And I was kind of bothered by something. I'm of 100% Finnish descent. All of my ancestors came from Finland back in the mining days. Some went up in the copper country, some went to Minnesota, whatnot. And I heard other people say that we should support immigrants today. And I agree we should. However, one should not conflate the illegal immigration that people are coming into this country looking for a handout with our ancestors who came here looking for opportunity. And I'm really bothered that people would sit there and sully the reputation of our ancestors who just wanted a chance at a better life versus people who are coming here because they're told they're getting a handout. You got to come here and work. And so I just want to push back a little bit on this notion that we're under some moral obligation to hand everything over to people just because I have an issue with that. So I just wanted to make that comment. Thank you.
Thank you, Mr. Hallinan. Is there anybody else that wishes to address the Board of Commissioners? I don't see any Zoom hands raised. I don't see anybody waving at me. So I'm going to go ahead and close the call to the public and remind the citizens that there is another call to the public at the end of the meeting. Item number 7 on the agenda is the approval of minutes. We have minutes, 3 sets of minutes dated February 22nd, March 3rd, and then closed session meeting minutes dated March 3rd. Is there a motion to approve the minutes?
Motion
So moved,
to
Gross.
support Griffith.
So motion by Gross, supported by Griffith. Roll call, please.
Commissioner Gross,
Yes.
Commissioner Plank,
Yes.
Commissioner Lawrence. You're muted.
Yes.
Commissioner Reader,
Yes.
Commissioner Nakagiri,
Yes.
Commissioner Helserman,
Yes.
Commissioner Dreck,
Yes.
Commissioner Zajac,
Yes.
and Commissioner Griffith.
Yes.
Motion carries.
So item 8 on the agenda is tabled items. We have no tabled items. So we're going to go ahead and move to item 9, which is approval of the agenda. Is there a motion to approve the agenda?
So moved, Lawrence.
Support.
Helserman.
Motion by Lawrence, support by Helserman. Any questions or comments? Roll call, please.
Commissioner Lawrence,
Yes.
Commissioner Reader,
Yes.
thank you. Commissioner Nakagiri,
Yes.
Commissioner Helserman,
Yes.
Commissioner Dreck,
Yes.
Commissioner Zajac,
Yes.
Commissioner Griffith,
Yes.
Commissioner Gross,
Yes.
Commissioner Plank.
Yes.
Motion carries.
Thank you. Item number 10 on the agenda are reports. We have 2 reports tonight, plus any reports from commissioners. I'm going to go ahead and ask if there's any commissioners that have reports before we start on the COVID vaccination and then the report from Nathan Bird, our county administrator. Any reports from commissioners tonight? I've got one if nobody else does. Okay, I'm going to go ahead. I'm going to share my screen. I have four slides. So says host disabled participant screen sharing. Does that mean I can't share my screen?
Commissioner Nakagiri, go ahead and try again, please.
So can everybody see my screen?
Yes.
Yes.
All right, so I did a little analysis of state of Michigan data. I just wanted to share with my colleagues and people here on joining us for this meeting. So the data sources, this is publicly available from the state of Michigan. There's some data regarding SVI, Social Vulnerability Index, and target population estimates that were used in this analysis. And then the data source for vaccine quantities shipped to counties. There's the links there. And that spreadsheet, all of the shipments was downloaded on Wednesday, March 3rd, last week. So there's these are the 10 counties with the largest vaccine shortage. What I mean by vaccine shortage, with social vulnerability index, I was curious on whether or not the state of Michigan was honoring at least, its number of vaccine shipments based on SVI. I am not a believer in SVI. I don't think it should be used, but that's what the state of Michigan has us using. So I wanted to take a look and see how good a job the state of Michigan was doing at honoring their system. So here's 10 counties. They were in alphabetical order. And how many doses they're short. These are the 10 counties with the largest shortage. So in the 1, 2, 3, 4th column over, you can see they range from
Commissioner Nakagiri, I apologize for interrupting, but we're not seeing what you're seeing, or at least I'm not.
Likewise, Mr. Chair, it seems that it was, there we go. Now we can see double slides here.
Is there?
There.
Is that, do you see a table with 10, the title 10 counties?
Saw it briefly.
We see
slide
slide.
one. You're still on slide one.
Let me do it this way. How is that?
There we go.
That looks good.
All right. Sorry about these are the 10 counties with the largest vaccine shortage. Livingston County is actually the 7th worst in terms of total shortages. Shown in red, Livingston County, we are down 12,455 doses. That's below what the state should have allocated to us based on social vulnerability index. If you threw out the social vulnerability index, Livingston County is down even more, 27,000 doses, which would be enough to do 13,000 citizens, which is about the last I knew the number that we had on our waiting list. And but you can see there's other counties that are in even worse shape. Wayne County, which excludes the city of Detroit, is down on the SVI scale of 83,000 doses. We move to the next slide here. So here's counties with the largest vaccine surplus. And when I say counties, I also want to make the point of saying that the city of Detroit is included here. It's got its own health department and they report separately. So these are counties with a large overage. And you can see it ranges from overages of 15,000 in Mecosta County at the low end to a high end of overage of 98,000 in Oakland County. So you can see that there is a disparity and it's these disparities I'm going to dig into further. I just compiled this information over the weekend and this afternoon. The last slide I want to show folks is there's 3 counties in the COVID region. It's called the Detroit COVID region. 3 counties that border each other: Livingston, Oakland, and Washtenaw counties. But all 3 of them, if you look at the SVI column, have very, very similar social vulnerability indexes. Therefore, we should be getting, on a population adjusted, about the same amount. But you can see that while Livingston County is down 12,000, Oakland and Washtenaw counties are up 98 and 62,000. So there's something, even though the state of Michigan is saying that the SVI system is fair, I think there's some other issues that going on. And like I said, I'll report back later to my colleagues once I get a chance to dig into this. So. Are there any other reports? Let me quit sharing my screen here. From commissioners. Okay. Seeing and hearing none, we'll move forward on the agenda to our health director, Diane McCormick, with an update about Livingston County.
Well, good evening, and Wes, thank you for the intro of your slides first before you get into my information. I'll start with the concerning news, including the vaccine distribution, and end on more of a positive note. Obviously, vaccine distribution is still a concern, and I'm going to talk about vaccination rates. So. And I look at the initiation, the first dose vaccination rate, not the completion, because it takes 28 days to completion. So once we get an initiation dose in, we have somebody in the system. So that's a positive note. So I always look at it as the first dose. So the vaccination rates for initiation first dose in Livingston County is below the state of Michigan average. The state of Michigan average is 20.9% of Michiganders has received an initiation first dose of vaccine. In Livingston County, it's 16%. And then drilling down even further into the initiation vaccination rates for who I'm most passionate about, it's the seniors, for those 65 and over. The average in the state of Michigan for the 65 and over population is 54.5%. Versus 39.4% for Livingston County. And I look at it from the state of Michigan as a whole and compare it. And there's a few counties, probably a handful, 5, 6, 7 counties that are like Livingston below the state average that really is concerning for our senior population in those jurisdictions. So we have an estimate of between 13 to 15,000 seniors that is still seeking a vaccine, a Livingston County resident seeking a vaccine. And we hear about our seniors needing to go outside of the county more so than inside of the county to seek a vaccine. And there's a couple of reasons why. First, there's the pharmacy program that's out there, so there might be some availability at the Rite Aids and the Myers, and also it depends on their healthcare system. And I'll give you an example. Ascension, on our vaccine interest form, we also collect what healthcare system that people are with. Ascension has about 3,400. On our vaccine interest forms as part of the Ascension group, which is St. John's Ascension. And so The only place that Ascension is vaccinating is Macomb County. So when you hear about they had to travel all the way to Macomb County, it's unfortunate that they have one vaccination site. So even if you live in Novi or elsewhere, they still have to travel to Macomb County to get that vaccination. I've had some opportunity to speak with the Ascension folks to see if we can at least get some of the vaccine out into the Novi area and or to our Livingston County site, so our seniors don't have to travel all the way over. I consider Macomb County the other side of the world when it comes to traffic. So that's my soapbox. So those are some of the travel and also IHA, Michigan Medicine. They have vaccination clinics and opportunities for our seniors that are part of their healthcare system down in Washtenaw County. So many of our seniors have traveled down to the Ann Arbor area to get their vaccine, and that's through their healthcare system. So I lost my place here. So we have a base allocation of Moderna that we receive, and that which is 1,400 doses. That is what the state has indicated, that Livingston County is the base. We may receive more, however, that's kind of the base in our planning figure in looking forward and getting future vaccination clinics going. We were notified last week that we would receive, and we have received 1,000 doses of Johnson & Johnson, which is the single dose vaccine, which many people are very, very interested in, and we'll be glad to have it out here in Livingston County. We have a lot of interest in a single dose vaccine for our seniors. And the following day, we were notified that Livingston County was one of a handful of counties that would receive additional shipments of Moderna, which was an additional 800 doses, and Johnson & Johnson, which was an additional 400 doses. So we received 1,400 doses of Johnson & Johnson and 2,200 doses of Moderna. Late last week, about Thursday, we received all the doses that came in. So yes, you're right. Beginning today, the state opened up the vaccination phase to include individuals 50 and over with underlying health issues and caretakers to children with special health care needs. And our phones have been ringing off the hook. And I will tell you, because of our numbers of our senior vaccination rate is still low and concerning, that Livingston County Health Department will continue to prioritize the 65 and over vaccinations for the next several weeks. If we have, for instance, clinics that might have some open appointments that we have not been able to fill, it hasn't been a problem so far, we will send out appointments to those that are in the eligible category. But we'll still be looking at the seniors as our priority group. So regarding clinic schedules, since last Wednesday, we vaccinated first doses to 2,000 seniors. We had, yesterday was Sunday, I was here all day. We had about 510 spunky seniors that came through yesterday. It was a fun clinic here. And we have planned clinics beginning this Wednesday, because we'll receive more vaccine on Tuesday this week. That's why we have a couple of days of reprieve this week, because we'll get the doses in on Tuesday. So we have Wednesday, Thursday, Friday, Saturday, Sunday, and Monday clinics scheduled. Most of them are booked. We've got a few open appointments, and we're sending out, we're not sending out 20,000 appointment opportunities. We're sending them out in like 3,000 to 5,000 at a time. That way, we get them booked up, and then we see what's left, and then we'll send out more appointment requests. But I want to tell you about next Monday on the 15th. We're going off site And we have scheduled a 1,000-dose Johnson & Johnson clinic at Chilson Hills Church. And and that, when I checked later this morning, I think we had, I want to say 500 spots already booked. I haven't checked by the end of the day, so I don't know where we're at right now. But if they're not booked, I know that we are planning on sending out a few more 1,000 vaccination appointments tomorrow as well. So watch your mailboxes, your emails for those, and also if it gets sent to your junk mail, just in case for appointment opportunities. And I've spoken about this at past meetings. We also have a phone bank. And we recognize that many seniors, they don't have internet, and they've been able to sign up either through 211 and or a friend. And the only way that we can contact them is through our phone bank. And so we also have a phone bank that are calling people, seniors that are on our list. That's all they have is a phone number. So we continue to do that too. So we have some equity built in to our system. I also want to talk about, I talked about the 1,000-dose Johnson & Johnson. Now that leaves 400 more doses. And so we are planning a drive-through for our homebound seniors. We've already started our homebound nurses on the run clinic, going to homes and vaccinating seniors in their homes. We started that. I think we're going to 10 homes. I think we went to 10 today or tomorrow, vaccinating seniors in their homes. But we also have an opportunity. A lot of these seniors, while they can't get out, they do have caretakers and or children that can bring them in through a drive-through. So we're opening up that opportunity, and Catholic Charities right now is scheduling and booking those appointments for our future drive-through, which I don't remember the date. It might be the 22nd. It's coming up. We will not receive any more Johnson & Johnson vaccine. We were notified by the state they're not going to be receiving any more shipments until the last week in March. So what we get is our first cache of Johnson & Johnson, and then the last week in March, and I don't know how many doses that we're going to receive, so it's hard to plan. But we will be receiving some additional Johnson & Johnson beginning the last week in March, and I believe going forward. So more information on that. I mentioned Chilson Hills Church, and I got to give them a big shout out. They've stepped forward. They approached us, and they've got a wonderful setup to offer their location to assist with our mass vaccination clinics. We had a team that went out there, I believe it was last week or the week before. I get my weeks mixed up now. And this site is, we can easily vaccinate between 1,300 to 1,800 easily a day out of this site. And so as long as they'll have us there, we are entering into a very easy agreement. As long as they'll have us, we'll be there. And once our welcome is no longer, then we'll leave. But we have other options as well in the community. But right now they'll let us store our equipment there. And I anticipate as the weeks go by, we will receive more and more vaccine other than the 1,400 minimum allotment. So we'll be able to stage larger vaccination clinics going forward. So I'm really excited about that opportunity, and a big shout out to the Chilson Hills Church. We're also planning future, once we start receiving more vaccine, mass drive-throughs clinics. And thank you, Christopher Toby, for getting us connected and doing a soft handoff to Huron Meadows Metro Park. They just have an ideal spot to do mass vaccination drive-through clinics. And their Metro Park police officers are standing ready to assist with crowd control, traffic control, in and out. So it's look forward to that. You know, and hopefully we'll be able to schedule something maybe later in May or even April if we receive enough vaccine to be able to host some type of mass vaccination drive-through clinic. So we're entering into an agreement with the Huron Meadows Metro Park. They are extremely excited for this opportunity to do this for the community. And as many times as we want to have a drive-through, they're open to that. So that's a good thing. Other positive things, I spoke with the regional Meyer manager last week. And he let me know that Myers is part of the pharmacy program through the CDC. They receive their vaccine directly from the CDC. The state of Michigan has no authority and or say so how much vaccine is distributed to Myers. It's between the CDC and Myers. They have been informed that, and I have no amount, that they will be receiving a lot more vaccine in the upcoming weeks, potentially beginning next week. And what the regional manager had indicated to me that they are looking at hosting some very large clinics here in Livingston County specific to seniors. And he will provide me more details when he has the information that he's able to share. But it could be in the upcoming next 2 or 3 weeks easily for them to get that going. They are planning large senior clinics in St. Clair, Livingston, and I believe he told me Monroe. And if you look at those counties that are falling behind the state's average, those are the counties that they're targeting. So more information to come on that, and they'll share it with me when they have it all planned. I definitely want to get that out into the community, make sure that people sign up on the Meyer website. I learned this afternoon also that Kroger in Michigan is being added to the pharmacy program and will most likely start receiving vaccine either this week or next. The corporate for Kroger's in the state of Michigan will determine, as does Myers, where the vaccine will be going. How many Kroger stores do we have here? 3, 2, however many Kroger stores with pharmacies. So we will most likely be seeing some opportunities at our Kroger stores. A lot of the Krogers in the United States are already receiving the vaccine. And the Kroger site does have a COVID vaccine site, and you click on the state. And when you click on Michigan, it says check back soon. So I anticipate that there will be, the Michigan link will be live in the upcoming days, and there'll be opportunities out there on the Kroger site. So that's my positive news. I always like to end on the positive side, and I'm open to any questions that you might have.
Mr.
Questions
Chairman,
from commissioners?
may I ask a question of Diane?
Yes, go ahead, Commissioner Blank.
Are you having any issues with staffing these clinics, or you have plenty of people? I'm just curious if there's any issues with resources as far as, I know you've mentioned several different clinics and places you're going. I had a conversation with a friend of mine whose husband is a firefighter in Rochester Hills, who the fire department opened up their location for vaccine clinics. And so my question is are you having any other issues with like staffing?
Right now it's staff fatigue. And, you know, the National Guard is assisting us, but they are getting stretched really, really thin. We are using our Medical Reserve Corps. So far, they have stood up to the challenge. We're also looking at, especially starting down at Chilson Hills, I think there's some firemen that are also going to join the ranks in assisting with vaccination. Right now, we're okay. And we do have a list that I received from the hospital of doctors that have indicated an interest that they would like to assist. Some of the doctors can do it after 4 o'clock. Well, so there's, their availability may not always match up to when we need it. We also have a stack, and I don't know, I can't define what a stack is, of volunteers that have expressed interest and signed up on our Medical Reserve Corps. We're in the process of vetting out that list and potentially onboarding some more volunteers. But yeah, this is, we're going to be doing this for a long time, and so it's going to take a village.
One more thing. I passed this on to Commissioner Nakagiri. There was a link that I asked him to pass on to you, which is a link that you can click on, and it tells you where the vaccines, where you can get the vaccine, the actual location, and it had in there whether there was availability or not. And then I believe it included links to sign up at those different facilities. I don't know if Commissioner Nakagiri had a chance to pass it on to you.
Yeah, he shared it with me, and I shared it with my team. I think the link came from the CDC, if I'm not mistaken.
It was a comprehensive. There was a couple of different links that were out there, but this one, I think they were bragging about how it was more comprehensive than the other ones that were out there.
I sent it on to my scheduling people. I wanted them to take a look at it to see if there was value into putting it on our website, and or would it add more confusion. And I need to follow up with them, but thank you for sending that.
Oh, you're welcome. That's all. Thank you. Thank you, Diane.
Any other questions from commissioners?
Mr. Chair, a couple of questions from me.
Commissioner Zajac, go ahead.
Thank you. Diane, thanks as always for your good report. Very thorough. And from the beginning, you and your team have been doing a great job. So I appreciate that. And I was glad to be able to join you last weekend, I believe, at the clinic at Howell. And I really liked the new setup there for those who were at the first clinics, and it was kind of, let's just get something together. Now it's like a well-oiled machine. And so that was really good to see. Couple questions. So the 65 and up, we're at about 13,000 eligible that are not, that have requested vaccines that have not been vaccinated. Is that right?
Yeah, I think it's between 13 to maybe 15. It's not below 13. Okay. How's that?
Okay. And then we also had some eligible frontline workers and things as well. Is there a number left for those?
The 1As, I'm gonna call it the 1As. That would be that they start out with the healthcare. We have provided opportunities to the healthcare group numerous occasions. If they haven't stepped forward, we are no longer seeking them out.
Okay.
When the other front line, the cops, I believe the first responders have all had an opportunity to receive vaccination, and those that were interested did get it. We're still working on the educators as well, hoping to finish them up before they go on spring break, but I don't think that's going to happen.
Okay. And then, so with this new batch of 50 plus with comorbidities, do we have any idea approximately how many that might be in the county?
I meant all day to look that up, but it's several thousand more. I can't give you an estimate. I meant to go to SEMCOG site, and I just didn't have time today to do that. I apologize, but it's tens of thousands.
Okay. Okay, so there's tens of thousands there, and we have 13 to 15,000, 65 and over, and we're only being a base allocation of 1,400 per week. Is that right?
That's the minimum, yes, that they asked for me to plan for.
Okay, so if we get the minimum, it's, I mean, 10 weeks until we're 65 and over. And depending on how many tens of thousands there are in the 50 plus, it's another multiple of weeks there as well. Is that right?
It absolutely is, unless all the vaccine that starts going out to the pharmacies and to other healthcare providers. So it's not totally on the backs of the local health departments.
Okay. And in that regard, this is more of a comment, point of personal privilege, I suppose, of me just making a comment at this time to speak here. But I'm tying two things together: Commissioner Nakagiri's report with your report, and it's very just again my thoughts here. It's very troubling that we have 10 plus counties that have this lower than SVI allocation. We have 10 more counties that have this greater than SVI allocation. And my question about that is, has the state given us as the health department in the county any sort of rationale for variances? I know there's been discussion about what we should be getting versus SVI, but has the state given any rationale for why that's occurring, those differences?
No.
We've asked though, right?
Yes.
Okay. Another point of personal privilege, a comment I'll just make is, to me, it seems nothing short of arbitrary. I can, looking at the numbers, it's sitting in many of these conversations, I can tie no legitimate rationale, let alone some sort of compelling reason why these variances exist. And it's very telling that the CDC now is stepping in and deciding to allocate to the Myers and hopefully the Kroger locations. And it's very telling to me that the St. Clair, Livingston County, and Monroe locations, the CDC is backfilling for where the state is failing in that regard to allocate vaccines appropriately. For any of our movie buffs, I was going to make a Hunger Games reference to say I volunteer to help. I can carry a few boxes. I can't probably shoot vaccines, Diane, but I can carry as many boxes as you need, as many days as you need. And I'm realizing that the Hunger Game reference is even more apropos, considering the nature of the government mistreating the people in that movie. And it's seeming to happen here at our state level as well. So I don't have any more questions. Thank you, Mr. Chair. Thank you again, Diane.
Thank you, Commissioner. Other questions, comments from commissioners? I have one. So Diane, the state of Michigan did publish and does publish, the quantities of target populations. They had a listing for seniors, citizens 65 and up, quantity in each county. They had a quantity of first responders. They had other quantities. Do you know if they're publishing, the state of Michigan publishing the quantities of people, citizens 50 and greater? Do you know one way or another?
That's a good question. I have not seen that. They have not published that. And if they do, I will provide that on to you. Yeah, it was interesting that now the state is going by age versus if you're essential, because they had it was the distribution of vaccine was to essential workers. So the next was supposed to be grocery store workers. And then last week they decided to base it on age, which I don't necessarily disagree with. Looking at the deaths and who has the issues more so with COVID. It is age related and dependent on your health condition. So now it's age, and they've jumped over the grocery store workers.
Well,
now in April.
Yeah, if they do publish that. I mean, I monitor the internet frequently, but if you happen to see the 50 plus number, I haven't seen it yet. I would appreciate landing my hands on that information. So
I'm sure it's on SEMCOG that we can get the number, or from the planning department.
Other last questions, comments from commissioners? Hearing and seeing none, our county administrator, Nathan Bird, has.
Diane, thank you.
Yes. Thank you very much, Diane. Very good.
Thank you, Diane.
Mr. Bird.
Thank you, Chairman Nakagiri and members of the commission. This is a chance to follow up on a question that was asked in one of our meetings last week about what our meeting formats need to look like moving forward. And we've got a couple options to consider, so I want to take just a few moments and outline those to you. No decision needs to be made tonight on this, but we do need to make a decision this month. So I'll go into some detail about where we're at right now. As you all know, we are meeting virtually right now because the Open Meetings Act allows for any reason virtual meetings of public bodies until the end of March. It doesn't sound like the state is going to extend that. And so that is driving us to make a decision soon on how we want to proceed. And so we have a couple options. The first is that we can continue meeting virtually, but only if we adopt a local state of emergency declaration. Those of you who were on the board last fall might remember that we were preparing to do this in the fall, and we actually had it on scheduled for an agenda for the Public Safety Committee, and then the state, just before that meeting, made the extension to March 31st to have meetings like this fully virtual until the end of March, and so we didn't need to consider an emergency declaration at that time. Now, if we want to meet virtually, as we're doing tonight, beyond the end of March, we would need to declare a state of emergency declaration. That would also allow the local units of government within the county to continue meeting virtually through that declaration if they chose to. It doesn't force them to meet virtually. It simply gives them the option to continue meeting virtually because they would be operating in a jurisdiction that has an emergency declaration. We have time to do this if the board wants to do it. We would introduce this at the March 15th public safety meeting. Our emergency manager, Therese Cremonte, has worked on a draft of a declaration and of a resolution. The reason for the emergency would, of course, be COVID-19. The resolution would cite the numbers that the county's experienced, and the resolution would also clarify that the declaration is simply so that we can continue to meet virtually until we're able to go back to in-person meetings. So that's our first option, but it's not our only option. It's important to understand that the MDHHS orders, as they're currently written, really impact what we're able to do and what we're not able to do. Last week, the state changed those orders and they relaxed some of the restrictions for in-person gatherings and meetings. But it didn't necessarily get relaxed to the point that is going to help us a whole lot. There is a 25-person cap on the number of participants in a public meeting. And so, as you can see, tonight, this meeting would not be permitted in person, neither would virtually any meeting that we've had the last year. Back in October, we had about 160 people in a meeting. Just a couple weeks ago, we had about 100 at back-to-back meetings. And so being able to get 25 people in a room, frankly, doesn't do a whole lot for us. Also, to hold a public meeting in person right now, masks are required for all participants, as well as implementing some additional social distancing measures in the room. And so that's challenging for us to look to go back to in person, and I frankly just don't think that's an option for us at this point. But there is another option that we can consider, and I want to read from you what the Michigan Association of Counties shared with us on Friday. They said that they continue to advise counties to rely on virtual only or hybrid virtual and in-person meetings to comply with the OMA and to adhere with the state guidelines. And so that takes us to our second option, which is hybrid meetings. A hybrid meeting is where a majority of the board attends the meeting in person and others would be able to participate as they are now through Zoom or through some other electronic format. We would likely continue to use Zoom. Those of you on the board last year may remember that we did two of these last year. We did one in July. That was actually my first meeting here. And then we did another one in October. I think they went okay, but they're not without their challenges. It's difficult with the cameras and the sound and the connections and everything to have that work flawlessly. But our IT department did a great job for that October meeting, and it's certainly possible for us. One challenge with hybrid is that it doesn't necessarily mean that members of the public won't come to the in-person part of the meeting. And so we could run into the same situation of having a challenging situation in the room if more people attended than what we could accommodate. We would be forced to have a way for them to participate in the meeting, even if they can't get in the room. So we would have to set up an overflow room where the meeting with two-way communication could be viewed from another location. And we'd certainly have to continue to have a virtual meeting option for all of our hybrid meetings as well. So it's challenging logistically. It can be done. And I want to be clear that whatever this board wants to do is what we'll make happen, whether it's remaining virtual or whether it's hybrid. But those really seem to be our only two realistic options as we head into April. Again, all in person just isn't going to fly right now unless we violated the state rules, which we've been trying not to throughout this. So there's a lot of moving parts to it. The current MDHHS orders go through April 19th. They could always be changed sooner, or they could always be, extended beyond. But right now it goes through April 19th. So we expect that those will be the parameters that we're working under at least through the first 3 weeks of April and maybe beyond. Again, no decisions need to be made tonight, but this is a pretty important topic. How we meet, what format we meet. And so, we will have discussion on this over the next few weeks. I will tell you that our intention was to introduce a resolution for an emergency declaration for discussion with the Public Safety Committee, a meeting on a week from today. If in the next week I get overwhelming feedback that you don't want to do that, then we'll talk about what our options are. But that's our intent right now, is to introduce that to that committee, see how they feel about it. And then if there was support to do that, going through our typical normal legislative process, we would have that adopted in plenty of time to start the month of April out in that fashion. So I'll be happy to try to answer any questions. I reached out to Matt Nordford on Friday and said, hey, if I say anything wrong, stop me or yell at me. So hopefully I didn't say anything incorrect, but a lot of moving parts, a lot of things changing frequently, but that's what we know at this point. So I'll be happy to answer any questions you have at this time.
Mr. Chair, may I?
Thank you, Mr. Berg. Any questions or comments from commissioners?
Sorry.
Did you say Commissioner Plank? I'm sorry.
Yes. Go ahead, Commissioner Plank.
So Nathan, and I'd just like to make a comment about that. When you mentioned that it would also be affecting the local counties, the local departments and everything, would it be wise for us to do a survey to send out to see how many people in our county that attend meetings virtually now? Is that something that they would continue to do while the orders are as such with this 25-person cap? Does it make sense to sort of send out a survey so we can at least get an understanding of where everyone in the county is at with, how comfortable they feel coming back into person or continuing to do the virtual? So that's just a comment in case I'm not available to be at that meeting.
Yeah, it's a possibility. I've had a couple discussions with some administrators and other staffers throughout the county. Back in October, it got to be fairly late in the month, and we started hearing from the local governments wondering what we were going to do. I've had one email come in already asking if we're going to do this. I've had some interaction with officials from Brighton and Howell, and I do plan to talk with others this week and reach out to them. And so that's part of it. There's some confusion, and I'm sure Matt could maybe clarify on this, but in some instances, I believe a locality could declare their own emergency, but some of our folks have said that they're not able to do that or they're not qualified to do that. And so, there's some confusion there, but definitely getting more input between now and when we talk about this at the committee level is something I'll be working on.
Okay, thank you, Nathan.
Mm-hmm. And Commissioner Chairman, I think that Matt was going to correct something I said or add to something I said, and just in case there's a chance to recognize him.
Yes, I saw Mr. Norford had his hand up, so I was going to call on him next. So go ahead, Matt.
I just wanted to point out that if you do want to have hybrid meetings, that would also require a state or local declaration of emergency. So right now, the way that the Open Meetings Act is drafted, if you wanted to participate, commissioners participate, you would either need that local state of emergency or something declared from the state in effect to participate virtually. Otherwise, the only exceptions are for military or health purposes. So I just wanted to make that clarification known that even the hybrid option, if say 4 of you are going to be in the chambers, 5 of you are not, or vice versa. If we had even a physical quorum present to participate, we'd still need to be under a local or state of emergency.
Thank you, Matt. I missed that. Thank you.
Other questions from commissioners?
Mr. Chairman,
Commissioner Gross.
this is a question for Nathan or Matt. If we went with the option of declaring a local state of emergency, would there be a time limit on that? Would that only be good for 30 days or 60 days, something of that sort, or would that be indefinite?
Yeah, the resolution that you would adopt, you would put a expiration date in the resolution, and so there would be a date to end the emergency declaration. But there's also a line in there that says that you could end it sooner if you chose to. You could basically terminate it at a sooner point. We would probably, as a placeholder, put in either the end of April or the end of May, give us a month or two. That may give our county time to hopefully receive more vaccines, might, give us a chance to get more people vaccinated before we open up our doors to larger meetings. But there would be an expiration point. And I believe that this is only an option for this year. So I don't believe that this continues beyond into 2022. Not that we envision doing this the whole year, but there definitely is you have the choice as the board to set the expiration date of it.
As a follow-up to Nathan, if it appeared as though we could do away with the local declaration of emergency early, would that require board action, or is that something that we could invest you with?
I believe it would require board action, and it could be done at the next available meeting. So if the state were to loosen the restrictions and we felt comfortable with going back to in-person, we could get a resolution together at the next meeting. I'm not sure, frankly, if I would be able to have that authority from the board to do that, or if it would need to go to the board. My assumption is that since you're voting to implement it, you would also need to vote to end it. But it wouldn't need to stretch out over several weeks. We would probably request a resolution at whatever meeting was coming up the soonest if you wanted to do that.
Okay, thank you.
Commissioner Drick has his hand up.
Thank you, Mr. Chairman. Nathan, what's the deadline for the state to act, to declare or not declare, to extend or not extend?
Well, it's really the end of March. I mean, if they don't have something adopted by March 31st, then we're in what is the current law, which is that we would either have to have an emergency declaration to have our first meeting in April, which would be April 5th. And I think that's our general government meeting that we'd be, and this does apply also to all of our committees as well. It's not just our full board meeting, but they have until the end of March to extend the any reason virtual meeting provision. The Michigan Association of Counties, I was on a second meeting with them today where they said that they don't think there's an appetite for the state to do that right now. And so, it may happen, but we're not planning for it. Back in October, we felt pretty strongly that it was going to happen. This time, I think there's much, much less certainty that they're going to do that. And so they have given us a way to continue to meet virtually, and I think they're going to rely on us to figure that out at this point. But again, we'll be watching whatever happens from the state between now and the end of March.
Thank you.
Mr. Chair, I have a question.
Go ahead, Commissioner Helserman.
Hey, the governor doesn't have power to declare an emergency. So this is not under the governor's authority. This is under the Michigan Health Department of Public Health. And from what I understand, they issued a order in October that goes 6 months, which, November, December, January, February, March, April, that is going to expire in April. And are we assuming that because they have another 6 months of their authority that they can extend it another 6 months? Because the legislature isn't putting this, isn't calling this an emergency, but it is the health department and it's not the governor. So could you clarify that and what the deadline is for the health department to do the second 6 months of an emergency?
Well, what the state health department is doing now, they're not necessarily doing it in 6-month increments. They just released new guidance and new rules. I think it was last Tuesday that go until April 19th. So that's not a 6-month window there. So they're revising things as they see fit and as the circumstances change with the coronavirus. And so there's nothing presently that looks out 6 months that I'm aware of. The situation with the Open Meetings Act, that was a piece of state legislation that was passed, I think, last October, that set the deadline of March 31st for no fault, any reason virtual meetings. And so when I say that we're not expecting to see that extended, I'm referring to, we're hearing that the state legislature is likely not going to do another amendment to the Open Meetings Act that will allow for an extension of that. It's really complicated because, the OMA is what it is and we comply with it, but it's the health orders that are kind of holding us back from being able to go back to more normal operations right now. And I'm not meaning to be critical of their orders. It's just, if there weren't a 25-person cap or if there weren't other things that we had to do, we could probably more seriously consider going back to in person, but we're not able to do that now without violating the state's order. We will always comply with the OMA. That's not a question. Our meetings are open, but we're also trying to comply with the state orders. And I don't know if that answered your question, but
in order for, I understand that the health department, state health department makes changes, but the reason that they can make these mandates is because they've declared an emergency. They have until April. That's when their first state of emergency was declared, and then they have 6 months after that to extend it. If there is no state of emergency, then they don't have the authority, if I understand it correctly, to make mask mandates or something of that order. To me, that's only because they have declared an emergency and they're legally, the legislature has given them that authority, and the weekly changes or the monthly changes or whatever are based upon that authority. They couldn't just, if there wasn't a state of emergency, they couldn't have these statewide mandates upon the citizens. So, Matt, are you familiar with when their 6-month emergency declaration is over? What date is that?
No, I think you stated it correctly, though. I think it was 6 months from October. I'm just not sure what point it was in October. The last order, I think, was October 5th or 9th. Yeah, so they originally adopted the order October 5th of 2020. I don't know when that's going to end. I have no idea if it's going to be extended either. You bring up an interesting point, which is, could we rely on that as the basis for continuing the meetings under a, the MDHHS state of emergency? And I think the answer to that is maybe. But to be certain, we're advising clients that if we don't have a clear position under the Open Meetings Act, to declare their own local state of emergency.
Okay.
Any other questions or comments on this subject from commissioners?
Mr. Chair, I have a quick comment.
Commissioner Zajac.
Thank you. I think Administrator Burt, thanks for being anticipating this and working with the emergency manager to get language in place. I think that a key thing you said in the follow-up discussion was with regard to vaccine. In my opinion, as I look at this, part of the state of emergency, if there is one, is driven by the under allocation of vaccine, putting the state in a position where they're causing this emergency for our county. So if we take action, my personal thought is there should be at least language reflecting vaccine under allocation within our state of emergency declaration if we go down that route. Those are my comments. Thanks, Mr. Chair.
Thank you, Commissioner. Anybody else? Hearing and seeing none, we'll move on to the next item on agenda. Item 11, it's approval of consent agenda items. We have 5 resolutions from 2020-03-030 to 2021-03-034 on our consent agenda. Is there a motion to approve the consent agenda?
Motion to approve, Griffith. Support, Lawrence.
We have a motion by Griffith, support by Lawrence. Any discussion? Roll call, please.
Commissioner Griffith,
Yes.
Commissioner Gross,
Yes.
Commissioner Plank,
Yes.
Commissioner Lawrence,
Yes.
Commissioner Reader,
Yes.
Commissioner Nakagiri,
Yes.
Commissioner Helserman,
Yes.
Commissioner Drick,
Yes.
and Commissioner Zajac.
Yes.
Motion carries.
Thank you. We have no resolutions for consideration, so we'll move to item 13, which is our second and final call to public.
Chairman Nakagiri, we do have one resolution for consideration, the late edition.
Oh, that's right. Yes. Yeah, I printed off my agenda. I printed off the old ones. Thank you for now I'm going to have to.
Would you like-
Mr. Chair, would you like me to read the resolution?
Yes, yes.
Okay, before you is resolution for consideration 2021-03-035. It is a resolution authorizing support for participation in the filling Michigan concerns regarding FCC 911 free diversion, NPRM.
I'll move the resolution. Commissioner Zajac.
Support, Gross.
We have a motion by Commissioner Zajac, support by Commissioner Gross. And I would like to thank Administrator Byrd and Commissioner Lawrence for bailing me out. I printed off an old agenda. So anyway, who's gonna address this?
Leanne Lowe is here.
Good evening, Commissioners. Thanks for the late addition for this. Few things I want to point out. The FCC has been required by Congress to create a list of allowables and disallowables for the 911 surcharge use. This is for nationwide. It just posted on March 3rd. That's the reason for the short notice. We have 20 days to get our comments filed to our state rep and then to the FCC. So currently the list for allowable and disallowable surcharge use for the Michigan 911 centers is created and enforced by the state 911 committee. 911 is not a one-size-fits-all business. Each state and county does have different needs and requirements and priorities. For Michigan, we use the state 911 office, which was created by legislation to govern our 911 centers, which I did invite the state 911 administrator to the meeting. Some of the things that they regulate are the 911 surcharge, the training funds, the fund distributions. With the FCC fee diversion, it's going to end up punishing the states that are in fact doing the 911 funds correctly. Michigan is in fact doing it correctly. We've had no issues that I've heard of. The departments in Michigan want to keep the fee diversion broad enough to be able to cover the infrastructure that we currently cover and still be able to protect the special revenue that we use. So if the FCC gains the authority to dictate this list of allowables and disallowables, many of the Michigan 911 centers, including Livingston County, will have several items that we are currently paying for that will no longer be able to pay for. Some of these items, such as CAD connectivity and the microwave project that we just finished in 2020, would not be allowed to be paid for in the new FCC diversion guidelines. Some of the things that we did cover in 2020 that were allowed are the microwave project. That one cost $285,000. Our radio tower rental fee that we cover is $497,000, and our MDC connectivity annually is around $6,500. If we lose the ability to pay for these things out of our 911 funds, it will end up going to the responsibility of each individual department, police, fire, EMS, or the general fund. If there is a violation to the list of allowables, it will end up resulting in the loss of opportunity for any future grant funds and make us unable to participate in any federal committees. The resolution that I am presenting tonight is not looking for any funds. This is strictly to support keeping our list of allowables and disallowables to be determined at the state level as they are now, and continue to protect the 911 surcharge revenue. Any questions?
Thank you, Ms. Muller. Any questions from commissioners?
Mr. Chairman.
Commissioner Gross.
Leanne, does this situation hit every county in the state of Michigan, or is there a smaller number that have 911 activity set up? How many counties are we looking at? Do we have any idea?
It's going to be all the counties that are currently getting any federal funding. I don't have the exact number.
And is it safe to assume that the state 911 office would be gathering up the position statements from whatever number of counties that would be impacted by this, and they in turn would submit a unified response to the FCC?
Correct. We do have one representative that the state office has selected that matches up with our Directors Association. So everyone that does get, every center that gets the surcharge funding has been offered the opportunity to submit comment. We're going to get it to our rep in the state. She's going to compose it and put it all as a packet for Michigan to the FCC.
Is there, do you know if there's a sense of urgency there that our response would be filed in time to be presented to the FCC either on or before their required due date?
Oh yeah, yes.
Okay. One other question, some of the dollar figures you mentioned, I think of the two or three that you mentioned, it sounded like there's a potential that your budget could take a hit of approximately $500,000. Is that about right? Or what do you estimate it would be greater than that?
That's probably a good estimate.
Mm-hmm. And has there been any indication on when, if the FCC did not react to our response, do we know when this would become effective? Would it still be in this fiscal year, or a year from now, or 2 years from now? Has there been any indication on that?
It's a year from the time that it's enacted through the legislation.
Okay. So does the FCC have the authority to just settle it all by themselves, or do they have to make a recommendation to both houses of Congress, or legislatively, what are we looking at? Do you know?
They will have to produce a list and present that to Congress.
Okay. So the likelihood of anything happening imminently is not there. It probably is down the road, but not to say that there's not a concern, but okay. Thank you.
Thank you.
Thank you, Commissioner Gross. Other questions, comments from commissioners?
Mr. Chair, I have a couple questions if I could.
Go ahead, Commissioner Helserman.
Yes, the first, does this affect the amount that we will be receiving, or just the freedom to it'll limit how we can spend it, or just, the distribution of the funds? That's my first question. You're muted.
It could potentially affect the income that we get if we're only able to purchase and pay for less, and it could reduce the funds that we would get.
Okay, yeah, and the second question is this, was this anticipated, or is this something that comes with the new administration? Is there any indication that this is a power grab for the federals, or is this just one of the things that happen when you're dealing with government?
It was, yes, it was actually slid into the last COVID relief bill at the end of December.
Okay, but was there any rationale to that? Did they, when they gave this information to you, did they give was there a rationale behind it?
Okay, it became an urgency with the 911 centers as they started hurting with the COVID relief bill.
So, but I don't understand why less freedom would help. I don't see the connection. Is there a connection between COVID?
Not really. That was their rationale. Every year, the FCC runs a report to check the diversion of funds, and that was just the rationale that they gave.
Okay. Okay. Thank you, Don. Thank you, Mr. Chair.
Thank you, Commissioner. Other questions?
Mr. Chair, a comment and a question.
Go ahead, Commissioner Zajac.
Thank you. Just to respond to Commissioner Gross's question, since this is a notice of
Hard to say this is the last
process, so the agency process does not have to then be confirmed by Congress. The agency rule. So that just answers the question. So my question though is, have we? If I understood you correctly, Ms. Lowe, we are not planning to submit our own comments. We're going to just rely on your comment, or did I hear we're going to do both?
The resolution is going to be our comment from Livingston County. We're going to submit it to one person in Michigan, and then it's going to be like a whole packet of Michigan comment going to the FCC.
Screwed up. I should have had full time.
I would ask Mr. Norford your thoughts on this, but under the rulemaking process, for any sort of challenge to have standing, don't we have to supplement, or don't we have to submit our own comments if we wish to rely on them in that process?
I'd have to look into this particular one. I am familiar, at least when dealing with the EPA, of this sort of bringing things together and submitting them at once. I'm not familiar with the FCC one, but we can look into that.
Okay, I would just so that we can preserve any sort of standing issues. I would just ask that the attorneys take a look at that. Thank you. No other comments, Mr. Chair. Thanks.
Thank you.
Mr. Chair, if I may, I have a question.
Yes, Commissioner Lawrence, go ahead.
Leanne, is our connection at the state Joni Harvey?
Yes, ma'am.
Okay. I see that Joni is on with us. And for the commissioners that just started in January, Leanne took Joni's position and Joni went to the state. So Joni was a long-term employee here at the county and instrumental in reorganizing 911. So Joni, what do you have any, other than passing this resolution, do you have any other suggestions for us?
If you guys wanted to file comments, you're certainly more than welcome to do that. And I know Matt's going to look into it and get back with everybody. The more information that we can get for the FCC to see that trying to approach 911 on a, you know how much you guys have to do when it comes to 911 and the central dispatch, community. How does that environment work when you have 13 police agencies, 11 fire departments and, 1 EMS. Now take that and expand that to a state. Now expand it across the country. I mean, it's going to be pretty impossible to try to come up with something or develop a list of allowables and disallowables that will actually meet the needs of all the communities across the entire nation. What we have in Michigan is significantly different than the way Ohio works or New York or anything like that. So if you wanted to file comments, what we suggest is that document I know that Leanne had sent out to everybody, that the NPRM, so that's a notice of proposed rulemaking. So that's what the FCC is using. And you're really gonna wanna focus on mainly what pages 9 through 12. I mean, that's the meat and potatoes of all of it. So those things in there, and they contradict themselves a lot. So when you're reading this document, if you get confused and you say, well, wait a minute, 2 pages ago, they said this was okay, and now they're not. That is in there. It's not just you. It does contradict itself, and it's confusing. So make sure that your comments are clear. Really focus on what Livingston County is doing correctly. Make sure that you make note that there has been no record of Livingston County diverting or misusing their 911 fees, and not for the state of Michigan either. So there's 83 counties in the state. We're trying to get as many as we can to get at least a resolution passed. A lot of these counties don't have time or the money, honestly, to file comments on their own. So this was an opportunity to still be able to join in on the big package we're trying to put together for Michigan. The State 911 Committee is also filing our own set of comments that I would be happy to share if anybody's interested in seeing those. But and so we'll have the State 911 Committee comments. Then there's the Michigan Communications Directors Association that Leanne was referring to. That who's getting the bulk of the information sent to them to present to the state. One other thing I'd like to add is we did apply for, we're putting an application in to try to get someone from the state of Michigan to sit on a strike force that's being developed. FCC is putting together a strike force to say, okay, we've received all the comments that all of the states are submitting. Now we have to go through all these and try to make a list that makes sense. So we are putting in an application to hopefully get somebody from Michigan on that strike force. We feel pretty confident that it's going to happen. So fingers crossed on that. That will only help us, but if it does get passed and it sits as it is, then we will have some conversations as a state to see what this means, So when Leanne was mentioning about the penalties for this, so they're essentially saying in that NPRM that if, let's say, I don't know, County A over here misuses their 911 fees according to the new rules, counties B through Z can't apply for any federal grants. It just doesn't make any sense. And the whole thing is just, it doesn't make any sense. So it does not fit Michigan in any way. They're just penalizing the very agencies that they're supposed to be trying to protect and help. So that's really the basis of the message that we're trying to get across. So if you wanted to file comments, please do so. There is a cost that will come with that. I can't remember exactly how much it is. I guess it just depends. Matt could probably find out for sure, around $500. Don't quote me on that. But the more detailed about Livingston County, how this is going to hurt you and how you're doing things right, make sure you highlight all those things.
Great. Thank you, Joni, and thank you, Leanne. I appreciate it.
Any other comments, questions from commissioners? Hearing and seeing none, roll call, please.
Commissioner Zajac,
Muted.
Sorry, yes.
thank you. Commissioner Griffith,
Yes.
Commissioner Gross,
Yes.
Commissioner Plank,
Yes.
Commissioner Lawrence,
Yes.
Commissioner Reader,
Yes.
Commissioner Nakagiri,
Yes.
Commissioner Helserman,
Yes.
and Commissioner Drick.
Yes.
Motion carries.
Thank you. We are at item 13, our second and final call to the public. Is there anybody that wishes to address the Board of Commissioners? Please either use the raise your hand function on Zoom or raise your hand physically. I see Ms. Flores Forward has her hand raised. Go ahead.
Jane Suarez Forward, Brighton Township, Livingston County. I just wanted to talk about, these are both evidently COVID related. I just wrote something out. I fully support our legislature investigating the Whitmer administration placing COVID patients into nursing homes. I don't know what went on. It needs to be fully investigated. I saw some editorials that bashed her or bashed the whole, it said it just wasn't good. But I want to say, I think that needs to be investigated. It's not good. I have a relative in a nursing home. Also, I support changing the law to not have these separation agreements that nobody can look at, nobody knows about. I mean, we pay for them. $155,000 to Robert Gordon, $87,000 to Steve Gray. What is that all about? We're not allowed to see what's in those. I think we should be able to see what's in those. That's kind of odd. So I support changing that law that exempts the administration from showing us what that's all about. That was kind of bizarre how he abruptly, those two gentlemen abruptly resigned. I thought that at the time. Now all this is coming out. So I am in full support of Bob Bizot and Lana Tyson and so forth, investigating all that. I think it needs to be done. So that's my opinion on that. And that's all I really wanted to say. I know I don't know if they're on the call or not. I can't see everybody, but I don't like to see those editorials slamming the people that stand up for the taxpayers of Livingston County and our senior citizens. So that's what I wanted to say on the second part. Thank you.
Thank you. Anybody else wishing to address the Board of Commissioners this evening? I don't see any Zoom hands raised. I don't see any physical hands raised. So I'm going to go ahead and close the second call to the public and ask for a motion to adjourn.
Move to adjourn, Helserman.
Reader.
Or Zajac.
Motion by Helserman, support by Reader. Roll call, please.
Commissioner Helserman,
Yes.
Commissioner Drick,
Yes.
Commissioner Zajac,
Yes.
Commissioner Griffith,
Yes.
Commissioner Gross,
Yes.
Commissioner Plank,
Yes.
Commissioner Lawrence,
Yes.
Commissioner Reader,
Yes.
Commissioner Nakagiri.
Yes,
Motion carries.
thank you, everybody.
Thank you. We'll see you all.